Mr. Lewis. It's so good to see you back today. Did you get my letter about your cholesterol test?
Yes, I was a little concerned about the high numbers, but I guess not exactly surprised.
I'm also concerned about the high numbers here. The reason we worry about high cholesterol is because it can increase your risk of heart attack or stroke. And these are two things I know you don't want to have. Given the results, we need to think about a treatment that can get these numbers down. But the good news is we've got treatments that are effective in bringing these numbers down.
Okay, I definitely don't want to have a heart attack or a stroke.
Yeah.
You know, my dad had a heart attack when he was a little older than me. I saw how it impacted his life and ability to do things. He just wasn't the same after that.
So, it is important to focus on the high cholesterol. Your total cholesterol is pretty high. It's 250, and the goal for most people is to keep the number below 200. The problem with high cholesterol is high cholesterol can cause dangerous accumulations of cholesterol plaques in the arteries called atherosclerosis, and this can increase your risk of heart attack and stroke. High cholesterol or hypercholesterolemia, as it's sometimes called, is sometimes the result of genetics, so it comes from your family members, but it can also be the result of unhealthy lifestyle choices. And it's important to think about a treatment that can address those high numbers.
So, Mr. Lewis, do you have any questions for me?
No. What do you think I should do?
Yeah, so for most people with cholesterol levels that are as high as yours are, our guidelines tell us to use a medication called a statin medication.
These medicines work to block the liver from producing more cholesterol. Now, we all need some cholesterol. It's important for good body function, but we don't need as high levels as you have. So these medications can reduce the cholesterol by about half, and they can cut your risk of a heart attack in half. The way you take them is you take it once every night, and then we check your cholesterol levels in about 6 weeks to make sure the medication is working.
Okay, well, I'm really not a pill taker. Is there anything else I can do?
I hear you on that, but I'm so concerned about these cholesterol levels that I really think taking a statin medicine is important.
And most of my patients who take these medicines don't find it a problem. They're pretty easy medications to take.
I wonder about changing my diet. I have a really bad diet. I eat lots of meat and cheese. I wonder if I take that out of my diet for a few months and then we check my cholesterol again and then see if I'm making any improvements.
I am totally in favor of you changing your diet to being heart healthy. In fact, I even have a sheet I'm going to give you that outlines some of these heart healthy choices, and I want you to take a look at that and take that home with you. I'm fully in support of it. But let's talk a little bit about the different kinds of cholesterol. So there are really 3 different kinds that are important to focus on. There's the LDL cholesterol, which is kind of the bad cholesterol, and you have high LDL levels. Now, the LDL cholesterol builds up in the arteries and it makes the vessels hard and narrow. There's the VLDL cholesterol, and it contains triglycerides, and these triglycerides also make the blood vessels hard and narrow. Finally, there's HDL cholesterol. You might have heard of good and bad cholesterol. Well, this is the good cholesterol. And the HDL cholesterol actually collects the bad cholesterol and transports it back to the liver for processing. Diet changes can help lower the LDL cholesterol somewhat, but it's really hard to raise the good cholesterol levels by diet changes alone, and most people need a statin medication to make the kind of changes to their cholesterol that are really important.
Okay, I am really not a pill taker. I worry about the side effects of this medicine.
So one of the most common side effects that I hear about are muscle aches, and this is reasonably common, but for most people we can usually change the medication and find a different statin medicine that doesn't cause this kind of muscle aches.
It's definitely good to hear. Are there any other side effects I should be worried about?
Yeah, so most people find that these medicines are pretty easy to take and they don't have a problem taking them in the long term, but you have to watch out for the muscle aches. Some people can get nausea, constipation, diarrhea. Those are things to watch out for. Usually not too much of a problem. I should mention that we also check your liver test to make sure that the statin medicine isn't causing any harm to the liver. Usually not a problem, and I check that in about 6 weeks after you started taking the medicine.
Okay.
Okay. So I have an information sheet about statin medications, and it outlines how to take them and the things to look out for. I'd like you to review this, and this is for you to use at home. I'm going to send the prescription for the statin medication to your pharmacy. Like I said, I want to know if there are any side effects that concern you or bother you so we can change the medication if we need to.
We also want to check your cholesterol levels and your liver tests again. So I'd like you to come back to have that done.
Okay.
Okay. I'm really glad that you're going to start this medication. I think it's going to really help you. Is there something else I could answer for you today?
No, I think that's it. When should I see you again?
About 6 weeks' time. Come back and have the lab tests checked then. Okay.
Thanks.
Good to see you.
Good to see you.